The recent fires in Tai Po, Hong Kong, is a stark reminder that fire risk can be presented anywhere, whether at home, in a hotel, or while traveling. These events happen suddenly and can become medical emergencies within minutes. Before we begin, I want to express my deepest condolences to those who lost their lives. May they rest in peace. My thoughts are also with the injured and with all the families and residents who are going through this difficult time. Out of respect for the victims and their families, I will not discussing the details of the incident. As a doctor, what I hope to do in this video is to explain the medical dangers in a fire that are often overlooked. My hope is that this knowledge may help someone in the future. First of all, the top killers in fires is smoke. About 50 to 75% of fire-related deaths are not caused by burns. They are caused by smoke inhalations and hypoxia. Smoke injury has three components. 1. Thermal injury. Hot gases cause burns to the upper airway. 2. Chemical injury. Fire releases toxic gases from plastic, foam, and textile, such as carbon monoxide and hydrogen cyanide. 3. Particular injury. Soot and metal particles enter the small airways, causing inflammation and pneumonitis. Therefore, we have to be aware of the correct way to escape smoke and to seal the door. We have to escape in loose posture, but not crawling on your stomach. Smoke and hot gases rise. Stay low, keep you in a cooler, less toxic air layer. The next point is, if a hallway or staircase is full of smoke, do not push through it. The reason is, dense smoke is high heat, toxic gas, and particulate load. Therefore, each breath worsens inhalation injury. Many victims collapse before reaching an exit. If you cannot see the space ahead, don't go. After that, if exits are blocked, first, go into your room, and then close the door. Seal gaps with wet towels and clothing. Stay low, and signal for help if it is possible. The next part I would like to talk about is airway swelling after smoke exposure. After inhaling hot gases, the larynx and vocal cords swell progressively. The danger is, symptoms often appear 6 to 24 hours later. The symptoms could include hoarseness, stridor, increasing shortness of breath, black and soot-stained sputum, difficulty speaking. In this situation, we may have to intubate the patient or sometimes even to make incisions on the neck. We just mentioned the toxic twins. I would like to elaborate further. The carbon monoxide binds hemoglobin, which prevents oxygen from transporting. The symptoms could include headache, nausea, confusion, and sleepiness. The hydrogen cyanide will block cellular respiration, which causes the cells not able to use the oxygen. It can progress extremely fast. Most victims who collapse in the fire are actually suffered from the intoxication. The medical management includes the 100% oxygen, and also we can give the antidote if cyanide poisoning is suspected. We could also give respiratory and circulatory support. Due to what I just said, we must be mindful for some red flag symptoms for those who have been escaped from the fire. It includes some airways red flag, like hoarse voice, stridor, worsening breathlessness, soot in sputum, or some burns around nose and mouth. We also need to look for some toxicity red flags, like dizziness, vomiting, confusions, unsteady gait, and also some delayed red flags, like worsening hoarseness, increasing cough, rapid breathing, fatigue, and altered consciousness. In case of any of this happened, we must seek medical attention. In this part, I would like to talk about heat exhaustions. Even without burns, extreme temperatures inside a fire can cause heat exhaustions. The symptoms could include dizziness, nausea, tachycardia, weakness, headache, near collapse, or even altered mental status, hot and dry skin, collapse. Heat stress often combines with smoke inhalations, making victims more unstable. In the last part, I would like to talk about the burns of skin. It can be classified in 3 degrees. The first degree burns is that it only affects the epidermis only. It normally appears to be red, dry, and no blister. It's often very painful. The second degree burn is that it affects the dermis, either superficial or the deeper one. it can have the blister on it. It will look red, moist, and shiny. It can be very painful or decrease pain. It depends on the nerve injury. The third-degree burns is that it affects the epidermis and dermis, and also the subcutaneous fat. It can look white or dark. It can be dry and leathery. It's usually painless due to the nerve being destroyed. For the first aid of it, first of all, you should cool it with running water, and then you should remove loose clothing and jewelry. After that, you should cover it with cleaned non-adhesive dressing, and then you should prevent body heat loss, and then you should send the patient for medical care. Please note, you should not use ice. You should not bursting the blister. You should not use tissue or cotton on the wound. In case of the burns affect the face, hand, feet, joint, or genital area, or if there is second-degree burns larger than a palm, or if there is any third-degree burns, or if there is any burns combined with smoke inhalation, send the patient to hospital immediately. Fires are sudden, and they often leave people with no time to react. But having the right medical knowledge can give us better chance to protect ourselves, even in the most chaotic moments. If today's videos help to gain a little more awareness or prepare you to care for someone in the future, then it has accomplished its purpose. My thought remains with the residents affected by the tragedy, and may those who lost their life rest in peace. I hope the injured and the family involved find strength in the days ahead. If this video helped you, please click a like and share it to your friends. I hope you can help more people. Thanks for watching, and I'll see you in the next video.